Guys who don't know me, there's 8 new recruits here. My name's Laura Mazurek, and I'm an emerge physician who's actually worked here for like 20 plus years. It's just that I've been doing a lot of other stuff, so I'm not always around. And people are asking me what are the other stuff I'm doing. Well, it's related to CBRNE, sort of training for healthcare. C is for chemical, B is for bio, rad nuke, and extreme events. So like basically disaster medicine, that type of thing. So what's something that's near and dear to my heart, and it's actually why I kind of got into this, was I was around and during SARS. I think, how many people here were here for SARS? I know Andrew was. Okay, Jacques. Okay, so you guys remember how our skin broke down, how the PPE instructions changed, and it's like being immunized against something. The arrival of or the threat of Ebola or MERS has sort of like caused my immune system to kick into gear and feel all sort of like this is feeling very similar to SARS, and that we really need to have some sense of what's actually safe to use. This is about advanced personal protection systems for healthcare. And the new recruits, you guys brought your Ebola stuff, so it's to see if you actually read the instructions, which is good. And what we're going to do later on in the talk is with the Glow Germ Challenge, which well, I'll talk about Glow Germ afterwards, but it's really used for mainly teaching kids how to wash their hands. That's very cool. And we're going to do it to see how your PPE protects you from a spray. So if someone was to cough at you, to see if you actually have adequate protection. So the protected code blue is personal protection equipment, choices for high-risk medical procedures, and I'll explain more about that. This totally came out of SARS, and it came out of SARS because people were wearing the recommended protection and still getting SARS. So we had some of our residents get it, some of our staff here actually got it too as well.
Hi, it's Mike Feldman.
Hi, Mike.
Hi, Laura, it's Rick.
Hi, Rick.
I'll just point out that during SARS, we also had about, I think it was 3 paramedics that got SARS.
Yeah.
They're amongst the first in the city.
Yeah.
They were the first healthcare workers in the city to be affected.
Yeah, and I can tell you, Rick and Mike will probably feel these new threats are provoking those kind of feelings that we had back then. Protective code blue isn't necessarily well recognized if you Google it. We're going to try and make it more well recognized in healthcare. That's part of my mandate from a federal perspective and from a bio perspective. It's really a health safety practice for a healthcare practitioner. We all talk about patient safety. This is about how we should be protecting ourselves from patients who have transmissible diseases. And their highest risk comes in places which are very common in emergency department. Intubation, we don't necessarily do bronchoscopy, but bag valve masks, anything that will aerosolize a secretion spreads it in the air, and turned out that was one of the most common reasons that the healthcare workers during SARS got SARS. It's invisible. They had no idea that was happening until they were falling sick. So they did try. These are actually, I think, Chinese workers. So they upped their their PPE, so maybe at that point they were starting to not get it, but if you wore that and intubated, you were still had a chance of actually getting SARS. So one of the things that was very noticed, we were just getting recommendations, what they weren't doing, and so Nicole getting just recently promoted to assistant professor, congratulations. For simulation. As being a big part of her portfolio, the testing of this equipment in a simulated work environment is not something done in healthcare, which should be done in healthcare, and there's lots of opportunity there for us to look at that. So just to outline and tell you a little bit of a story, I've sort of talked to you a bit about it already, which is SARS. Define the high-risk infectious disease setting in a very simple way so you can think about that. Talk about personal protection systems and how you choose them to match the risk, and then we're going to do what I think is the fun thing, which is you put your PPE on, we'll do the Glow Germ Challenge. We'll talk about where we should go from here. A very strange thing in 2003, Saturday evening, why I'm on my internet, I don't know, but I get an email from WHO, which is even stranger yet because I have no idea how they have my email. And there's a warning for physicians to beware of travelers returning from Hong Kong and China with atypical pneumonia and wear an N95 respirator. Well, I can tell you, I bet you, I certainly didn't know what an N95 was. I thought it was that thing on the left there, the scuba tank. I thought respirator was scuba. But, you know, I quickly went onto the internet, found out it was something that's used for TB, but we never dealt with TB, so we really didn't have any masks, and none of us were fit tested at that time. Never seen one before, didn't know you had to be fit tested. I can tell you, by far the majority of people were not fit tested during SARS. I don't actually know when I got fit tested, maybe a year later, I'm not sure. And I called the emergency, and some of you guys will know Luis. Luis was on that night, and he was actually seeing an elderly woman from Hong Kong who had a respiratory infection. But somehow he had got some warning. Nobody had come to talk, but he was aware somehow that he needed to take extra precautions. They managed to find it. But it turned out she didn't have SARS, which was good, because it could have been our first. Like the first ones were super spreaders. It could have been. We could have been the Scarborough Grace that went down. It wasn't. It wasn't that situation. It's also another interesting just tidbit. Ivy Cheng, who's another one of our docs, we were getting a SARS patient transferred to us, and I was teaching clerks, and she says, "Lori, come and bring all the clerks. Let's go see the SARS patient." And you know, sometimes some things are not good teaching situations. What was this particularly troubling during that time, and that's why I think I'm feeling very passionate about this, that the recommendations were changing. We relied on others to give us expert advice. We started out with a simple mask, I think, and gloves and gowns, and then it quickly escalated to N95s and so forth. At one point, we were wearing a double-double, and some of you guys will remember this, that it was 2 masks, 2 gloves, 2 gowns, goggles, face shield, bouffant, and slippers. And one of our docs did a blood gas, and just to see what, because everybody was really irritable and miserable in this stuff. His PO2, arterial PO2 was 60, and his PCO2 was 60. It was Dell. Some of you guys might know Dell. It was crazy enough to do that. And despite this, there were still people getting SARS. So we decided, a group of us, that this is really not a good situation. So internet was just sort of, and collaborating through internet was just coming online. And so what happened is a certain group of frontline people, myself was included, we started talking to Hong Kong. Some people spoke Chinese. They spoke to the Chinese and different people and said, "What are you guys doing? You must have figured it out by now." And they came up with some interesting survival guides. One was actually Justin Wu, who was an internist in Hong Kong. And his first things said to survival is be paranoid and vigilant and make sure you learn about this stuff. Later on, what we did is here, these are something called strikers. We didn't have a clue, but we knew we needed to be body encapsulated. And one of the biggest problems we had were fogging. So what you can't really see here that well is, this is a suit that has a fan so it doesn't fog. It's actually used by surgeons. That's why we thought it was good, because we would have them. Surgeons doing total joints so that they don't actually contaminate the field. And they need their vision kept clear, so they have a cooling fan so they stay cool and it stays clear. And this, anybody using a striker did not get SARS. And then the next one up from that, and I'll show you later, is something called a PAPR, which is like this, is a powered air purifying respirator, which just has a filtered air being blown through. So protected code blue, we knew we couldn't get everybody into everything, so this is actually an RT. She got SARS, so she was pretty passionate about it. And this is just at the time we were putting this information together. She got SARS shortly after that. This was the sort of like the double-double. The bouffant, the shield, the goggles, the N95, and then for some reason we're wearing porous gowns. So I think this, we'll look at what our recommendations are for Ebola, but if you think about MERS being similar to SARS, we need to think about MERS and Hajj coming up, which is the big pilgrimage, Islamic pilgrimage in October 2nd to 6th, where millions of people go there, and that's actually the hotbed of where MERS is. It is possible people might present from it. The highest risk is in a code, so that's why you get protected code blue. The idea is if you have someone who's got a fever and it's a respiratory situation, especially where you have any of the high risk indicators, you should be protected if you're going to do any kind of resuscitated procedures on them. So I'll certainly circulate this PowerPoint for you guys, but one of the biggest things was really understanding the dangers, and that's the aerosolization of these body fluids or secretions that puts you at the highest risk. The other part of this is that, you know how we invite everybody into the code? Well, they realize that you need like 3 people. You need the RT, the doc, and the nurse, and there should be nobody else in there, and everybody else should just be handing things in and out. And in and out, literally what you should be, and you should be properly dressed, and simulated training, which we don't do. I really feel we need to, even if it's seasonal influenza, and particularly bad, we don't want a doc taken out because of that. So we should probably look at how to trade and do this in PPE. So the same principles are valid today. If you look at your own PPE recommendations here, and we will look at that for Ebola. Ebola is just transmitted by body fluids. Well, these are the guys looking after Ebola. Do they look like they're just, body fluid is just like your gloves and maybe a gown. So I don't think they're dressed quite the same way. These are the guys that are actually doing the care. And if you look online, you will see the PPE that they're using in front lines. They're sending you a message. If you ever had something this lethal to deal with, you better ramp it up. So you can learn from that. And what you also see here is, does anybody notice what kind of masks they have on? I mean, it's not masks, goggles.
Ski mask.
They're ski masks. Why?
They don't fog.
They don't fog, right? And they give you much
Hello,
deeper
Luis.
protection. Hey, Luis. And they're also hoods, not the bouffants. And those two things alone are pieces of equipment that are very affordable, because these are African countries that don't have a lot of money, so they're doing affordable, effective sort of protection. So what you need to do is, part of it is recognizing there's a danger, and that it could potentially pose a threat to you. But remember, gastro can take you out, and influenza can take you out, so you should treat those similarly, although they're not going to kill you or not likely to kill you. So I don't know what you guys know. I told you Ebola is spread by body fluids. Does anybody know how MERS is spread? Or what kind of virus it is? Anybody? Coronavirus. Do you know? Yeah, coronavirus is, what's the most common thing that a coronavirus causes?
Cold.
Common cold, which is why there's never going to be a vaccine or treatment for it, because they mutate so fast. And SARS was a coronavirus as well. H7N9, does anybody know what that is?
An influenza.
It's an influenza, it's an avian influenza. Not as, MERS kills about 50% of the people it infects, usually older people, over 60. H7N9 is just coming out of China right now. It's an avian influenza. And SARS, does anybody know how SARS was spread?
Droplet.
So there was a
Droplet.
right.
Yeah, and it was controversial at the time, and I'll tell you why.
That, isn't it?
They felt that droplets can be sheared and smaller particles created, so that you could actually just, maybe a part of a virus is enough to infect you. Because they're trying to understand why people wearing PPE were getting infected, so that what they think is that's probably what was happening, although it was never really sort of
Plus the
decided.
disease had different stages, so like the spread changed during the course of the disease.
Yeah, it
and
could-
not in everybody. So
Yeah, it could be gastro, and then it could go into respiratory.
but it's sort of when the people became super spreaders, like their viral titers actually made a difference to their infectivity.
Yeah. So super spreaders are the ones that really start things. Like we have one super spreader here that caused
The protection worked until a patient transformed into a super spreader, and then when they were at the sickest, when they were in the super spreader stage was associated with like end stage lung disease, so those are the ones who needed to get intubated. So it's sort of like things were working, and then we had this different.
Yeah, it's
behavior.
really whenever, but it wasn't just intubation, it was BiPAP, it was nebulization of too as
Yeah.
well, because we
Well-
went away from all of those things. So the precautions are to match the disease, but what the consideration needs to be is none of these precautions really tested rigorously in a simulated environment. So one of the things we found with SARS that they didn't want to paralyze the patient necessarily, and so they were struggling with patients which would displace PPE. So that quickly was solved by paralytics. But the idea is that you may want to think about higher precautions, and you'll see that. SWPF is Simulated Workplace Protection Factor. So this is actually recreating the simulated environment and seeing how it performs. Does anybody know the difference between a respirator and a mask?
A mask is a filter. A respirator is like a.
No. There's only one mask. It's the surgical mask. Everything else that you have is a respirator, which is it's sort of like to say it filters. An APR. Does anybody know what an APR is? It's an air purifying respirator, gas mask. And a PAPR we don't have, but it's one that blows air into the thing. And those will give you the highest things. So here's the diseases. As you can see, the ones we worry about haven't really killed that many people. When you think about SARS, it caused a tremendous fear in the whole thing, but smallpox killed 300 million. So there's a different perspective. Smallpox, so if it's deadly, if it's a virus that's airborne, smallpox was an airborne virus. If it's contagious, because some things are limited in contagious, like TB is airborne, but it's not that contagious. Still, we take precautions. Has no effective treatment and no vaccine. This is a simple system, and that if you start to add up these factors, and you can start to see how lethal they may be. So smallpox, very lethal, 300 million. Spanish flu, 50 million, up to 50 million. Malaria requires a vector, but still fairly lethal. So if you look at Ebola, it's deadly, it's contagious, it's not airborne, doesn't have any effective treatment, and no vaccine available. So it's got 4 of the high-risk features. MERS is the same. It's essentially the same, and it's not airborne either, but more likely to catch it because it's respiratory. Seasonal influenza is not that deadly because it's contagious. Not that deadly to us, I should say. There are certain populations that are susceptible to it, and they can be much more deadly to them, but in general not to us, especially if we use a vaccine and there are antivirals at work, but if they don't, it starts to change the score. Same with Norwalk, generally not. Very highly contagious, but not very deadly, but in countries that they can't hydrate people properly, it can be deadly. So here are the high-risk procedures, and this is a glow germ. You can see this is actually a simulator for the kind of like cough, and so this is a glow germ mist. And they're trying to just show how far these things will go. So we'll do something like that, so a cough and an airway procedure. The other thing is if a patient's delirious or agitated, you better sedate them or think about paralyzing them before you intubate them. Sometimes we pause about that. This is not a situation to pause. We should knock them flat. And some people wearing PPE and not. If you see people in PPE and they're with a patient and you're not wearing PPE, maybe you better wonder why they're wearing it and whether there's any risk going on. And I talked about this already. One of the highest risks is changing PPE. It tells you that it's signaling to you that they don't really know how to protect you properly. Okay, so personal protection systems, I'll just go very quickly. Respiratory is the most important thing because if you inhale it, then it's in. You're not like, if you get it on your skin, you can wash it off. You inhale it, it's not coming. The higher the number, the better. So you can see there the N95 has a protection factor of about 10. It might go a little higher depending if you combine it with other things. A surgical mask is equivalent to putting your hand over your mouth. It was never designed to protect you from organisms. Do you guys know what it was designed for?
Protect the patient from your
Right,
cough.
exactly. And so if you have a coughing patient, it does reduce the spread in the environment. So it's a good idea to put that on them or a filtered mask. So we will never get to this point. This is like movie style. This is like, what was that with Dustin Hoffman? Outbreak or something like that. Yeah, and in the in the labs, they wear things that they're actually connected to oxygen. They can walk around. This is a level 4, like hantavirus or really lethal viruses. We will never get there, but you can see the protection factor is 10,000 above. That's a little higher than 10. So this, however, is anywhere from 100 to 1,000. So now we're taking significant jumps in protection. And these do come with N95s. Yeah.
Just a note of caution. You know, like I like to, when I train people, the in SARS-2, the main issue was contamination when you removed your contaminated material. So the protection was fine, right, but it was when you're taking off your material. So I like, the reason I bring that up is with a new piece of equipment that has more attachment points and stuff, just have to be careful about that because.
But what is
you're-
it telling you need to do?
Well, I'm just saying you develop a set with existing equipment about how to peel it off properly so that you don't self-contaminate. When we change equipment though, we just have to make sure it's not just like an equipment fix, that we also have the training, because this thing is more complicated to take off.
Yeah.
So I'm at
This
further
will be
risk of
covered.
contaminating myself when I'm taking it off versus the thing I use already and I know how to do that.
Yeah, absolutely, but what this is saying is, we need to look at higher equipment and the training to go with it. Even if you use the regular equipment, I tell you, in this environment, you need to train to do it well to protect yourself. Powered air purifying respirator, which just has hood, and what it does is filters, it sucks air in, and then it's like a bouffant, it's like a hair dryer thing, and it blows filtered air in, and it's positive pressure environment inside, so there's nothing coming in, it's blowing it all out. That's is up to 10,000 protection. So that's the other thing. If anyone's ever used one of these things, they're cool and they don't fog, and they're probably actually easier in some ways than this, which has this straps. That thing you just take the hood off. So face and body coverage. So this is, I think, close, the one on the left is close to what we are recommending right now for Ebola. So you have to be aware of the exposed skin, right? Because you don't see these things and then later on you go and eat and whatever. And the other thing is when you double up like that with those recommendations, it really fogs. And actually I just put it on, just before you guys came, I actually didn't realize, I didn't feel this way before, but I actually felt claustrophobic. And one of the things that they do warn you about when you start to put on multiple layers, you can get claustrophobic. And if you have never experienced that, it is possible that you could. And you don't want to use an absorbent factor. So they're coming back to the Ebola guys. I think they actually have a great system. I like the hood, I like the bodysuit, and you know, how would you ever clean those straps? I don't know, but the number, it's a lot cheaper than one of these. So if they can invest in, if they can buy these things, they could buy those things. I'm sure they're like $20 compared to whatever this is, $100. And I don't think it'd be too hard to train in something like that. The one on, this is a PAPR system. This is what they use in labs. Very cool. And if, you know, honestly, if somebody was doing chronic care and anybody really that sick, that's probably what we should be doing. So just comparing PAPR 10,000, the other one is 10. Now I'm going to tell you right straight up, it would be very unusual for you ever to have to intubate an Ebola patient, okay? So let's just say this was a MERS patient. Actually, I'll just take a look at MERS. The only difference between MERS is to have an N95 instead. But if you guys are okay with him leaving a P2000 on, yeah? Okay, so we can put him in a high risk. What do you think is the high risk situation for us usually?
Emergent bronch.
Okay, a bronch or an intubation, right? So if they coughed, would you think a shot up would be close to that?
Yeah.
Yeah? Okay, so if you were gonna take a position, you were gonna intubate this guy. You probably have a bag on, but you always take the bag off to intubate, right? So if we were smart, you would paralyze the guy, okay? And this would not happen, okay? But if for some reason you're just getting ready and you want to check before you paralyze him for some reason and he coughs. I don't know if this will work or not. I've never done this before. So we're going to
Don't
see.
do this at home.
Huh?
Don't do this at home.
Yeah. Okay, so one of the things is, okay,
Yeah,
he's got his
Susan,
face
come back.
down right now. If he ever looked up and coughed, I think it would, okay, so, okay, I think just do a practice shot, just gonna make, Yeah, make sure, can you want to turn that light off? Okay, so if you guys can try and film this and I will.
Do we have a blue light source?
Yeah, yeah, actually, don't turn that on, Ray. If I can get one of you guys to, yeah. I don't know if we'll catch this or not, but what we want to do, okay, do you think that's about right?
Yeah.
Okay, so we're ready? Okay, let's just see.
Shoot.
Well, I got him on the face. Okay, let's come in and just take a look where it got him.
Oh, it's got spots on the gown, on the neck. Oh, yeah.
Oh.
Okay, so you wouldn't even know
Very
that, I don't
dirty.
think,
CSI.
honestly. Yeah, do you want to come and just take a picture?
Up over that, yeah.
Yeah,
Put your head down. Anything? Yeah, you've got some specks in your hair too.
okay,
Yeah.
What?
Yeah.
okay.
Yeah, you do.
Got the goggles. Oh, you can see how fogged they are. You just, can you see? I don't know, maybe you guys can't see, they're totally fogged.
Got some inside.
This is a full body suit. Okay.
Lovely.
So,
I would put it outside.
yeah, no, but this is,
I don't
this
wanna-
is why we should be in there kind of working out these steps, right?
Put the mask
I would put the mask outside because
Gloves are the first thing you take off, though, right?
Yeah, we'll do the, we'll try this way. You can also jog afterwards.
yeah,
if
the
you
first
try-
layer
yeah.
of gloves. Yeah.
Yeah.
Okay, so put this on.
Oh, you got two. Okay, yeah.
Okay, now, do you want the face shield or not?
Yeah, give it to, yeah.
It's up to you.
Okay, let's go to the.
Okay, does this look about right? Okay, let's see.
Yeah, it's on the mask.
On the outside, okay, now you take the mask off. Come closer. Definitely there. Anything on her face? Okay, face? On the mask? Let's see if you can take this off, and then we're gonna look at you afterwards.
So,
Take your suit off.
okay.
Your
Where?
hands.
It's like operation.
Oh,
Right
yeah,
there.
see?
Yeah.
Okay, so she touched the
That's on
outside of
her
her suit.
face, too.
Okay. Yeah, let's get your foot in there. So this should be fit tested, and you're put it on with a dresser. In other words, someone checks you to make sure that you're okay. And in the protected code blue, the idea is someone is outside in lower PPE that is your assistant and checks you to make sure you're good. So I would say be her dresser, and I would say you're good to go, and then you go. I want to make sure that I really blast her well. Okay, because, you know, this is the risk area. I want to make sure, okay, let's go around. Okay, you guys agree, like, nobody would ever get,
Can you hear me?
yeah?
I'm going to leave the teleconference in a moment just because I'm missing out on all the fun, it sounds like.
Yeah.
I just wanted everyone to be aware that I'm working with the Ministry of Health Ambulance Services branch, that if we have a person with a positive travel history to West African countries that are affected and to Arabian Peninsula countries that are affected by MERS, that starting, I'm not sure exactly a date, but in the next few weeks, hospitals will be notified. Dispatchers will be screening callers, and hospitals will be notified when an ambulance is en route. Doesn't mean they have it, it just means that they failed the screen. So that will be an important additional component as to whether we want to use these procedures on EMS arrival and whether we put the anteroom and the isolation room into use.
Okay, thanks. All right.
Okay, thanks, guys.
Got it? Got it? Now let's go do this. Okay, so let's just,
I think you got me.
did I?
I think it
Okay, let's
wasn't
see.
tight on the side.
Okay,
On her
so-
face.
I don't see anything on your
No?
face. No. Okay, now
A
let's,
little on your nose, actually.
interesting. Oh, you know why? Because there's no filter. Okay, so if you usually
Set
have
me
a
up.
filter. The number one recommendation is to select and train protected code blues that the people who are going to do the test procedure, test their protection systems in a simulated workplace. So we, I did it as best as we could here, but we could certainly do more. And there's probably grants actually that could be used to support that. And you should think of a higher level of protection when you're dealing with especially deadly disease. For one, we won't have them very often. Two, your anxiety level is going to be really high. And for those of us in SARS, like my son was 4 years old then, my biggest threat was, or fear was, not that I would die, but that I would take it home and give it to someone else I really cared about and they would die. We never did follow through to get this nailed down. The fact that these diseases are now posing a threat, they're saying that there's going to be at least 20,000 cases of Ebola, and that once it gets to African cities, we will see it exported to us. I don't know. And advocate for the safety of your healthcare team. If you don't feel safe, take the time either to make sure you feel safe or express your reasons for why you don't feel safe.